detecting signs of neurodegenerative disease in minutes instead of years. That's what the NeuroClues eye tracking technology can do. At the CHwapi Hospital Center in Belgium, neurologist and rehabilitation specialist Dr. Thibault Warlop has been using the device for almost a year to measure abnormal eye movements, primarily in Parkinson's patients.
The main difference lies in the transition from qualitative and subjective observation to objective and quantitative measurement. So while the traditional bedside tests, follow my finger, for example, depend on the clinician visual inspection, NeuroClues use high-speed sensors with a high resolution, spatial and temporal resolution that is able to detect micro-movement that's physically impossible for a human to see. And unlike traditional eye tracking system, NeuroClues is built for clinical practice. So combining medical grade hardware, standardized protocols, high precision, and also quick analysis. So in short, NeuroClues bridges the gap between high-level precision of research and the everyday clinical practice.
Eye movements while tracking specific shapes are recorded within 10 to 15 minutes. The recordings can be viewed immediately and, most importantly, repeatedly, allowing for the assessment of data. Depending on the pattern, Dr. Warlop can determine with much greater certainty whether the movements deviate from the norm. The device is practical for everyday clinical use. It is lightweight and portable, and as a plug-and-play solution, easy to use. The technology can achieve much for Parkinson patients.
We have data that shows that more or less 20%, 1 in 5 Parkinson diagnosed patients will have a misdiagnosis. We want to help physicians and clinicians to be able to give better differential diagnosis thanks to our device. We want to help them be able to give them a better treatment option. And we don't think that it's fair to tell people you'll live a very long life where you should be expecting something completely different. So it's also a matter of give better communication to these patients throughout their treatment.
The NeuroClues technology recently became ISO 27001 and CE certified. The startup is spreading its wings.
So we are finally moving from a setting where it's a purely research company to a company where we're actually finally deploying our device to the market, and we're growing more and more.
Neurologist Warlop envisions a wide range of applications for eye tracking systems in the future.
The majority of our patients are patients suffering from Parkinson syndrome, but we can also use it for every movement disorder that we cannot explain, such as a young male, for example, with a diplopia without any ophthalmologic pathology, for example. We can also use it for MS, multiple sclerosis, but this device will be used in an increasing pathological population, such as the brain injury, for example, and so on. We are moving toward a more objective, quantitative, data-driven medicine, and NeuroClues offers to us and to our patient the possibility to detect subtle eye movement abnormalities years earlier